chronotherapy or chronomodulated chemotherapy started off by one gentleman that ended up running research out of VA hospitals in the US. It was his idea. His name is Dr. William Reshevsky, and Bill worked within VA hospitals, first did enormously difficult work. This is pre-computer era with mice. As you may or may not appreciate, mice are running around your kitchen when you're asleep, and you're running around the kitchen when they're asleep. And so after all that data was done with different cancer drugs and stuff to determine what was the optimal window on a 24-hour clock, when's the drug the most effective and when is it the least toxic, they had to take all that data and flip it because of the mouse versus human issue. And then they had to rerun all of these studies. And these studies actually grew in the chemo window, and the VA hospitals pretty much ran out of money in the early 2000s. And so a lot of our targeted drugs we don't have, but we do have because of one of the students of Reshevsky's went back to Europe, and he did some really brilliant work with immunotherapies as well. So we know pretty much the chemotherapy world and the immunotherapy world, how to time these drugs. But it's not just what time of day or night a drug is given, it's also the style of the infusion. So the style of infusion, the analogy I'll use is frogs and boiling water. You drop frogs in boiling water, they jump to save their skin. You drop cancer cells in a pool of high concentrated chemotherapy, they shut their pores, they congregate, and they go to sleep. They go dormant to save their skin. What the routine is in cancer care is to give a bolus dose all at once or a high concentration drip. Cancer cells aren't stupid. They do just what I said. They close and they go dormant. What we do instead is we start with a tiny trickle of drug. And as we give that little bit of drug, it actually agitates cells, and they start gobbling drug at 40 to 100 times the rate of a normal cell. One bite normal cell, 40 to 100 with the cancer cell, one bite. And what we do is we slowly ratchet up. We use special technology, special pumps to deliver the drug, and we ratchet it up, 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 up in that same sinusoidal curve that actually, you might argue that frogs in boiling water, use, and he has a terrible analogy, but it works. You can kind of get the idea. It so happens that we get somewhere as much as a 80% drop in adverse effects. I have patients, I have two almost identical colon cancer stories, both East Coast patients in major cancer centers. One could not tolerate drugs any longer, had a relative as an oncologist and agreed, stop and put him in hospice. The other one, the therapy completely failed the patient. Both came to us. I show slides sometimes with one of them jogging on a treadmill on his last cycle of treatment in complete remission with no evidence of disease. The other one, we actually had one recurrence about 2 years later. This was a 2007 diagnosis, and fully got him with no evidence of disease, recurred, got him back into no evidence of disease again, and he's been fine now for whatever that is, approximately 15 plus years with it. And so we know that it cuts toxicity in a major way. I actually have a study attached here. It improves treatment response, treatment outcome, but fascinatingly, we can re-challenge patients with the same drugs and the same doses that failed the patient previously and give them back. And 50% of the time, the literature says, it's not just my experience, the patients will respond, and they'll respond terrifically. to it. The top of this is the sinusoidal curve of the infusion, and we use these very special pumps with a considerable amount of complexity in terms of technology. The whole staff, everybody has to be on the same page, the pharmacist, tubing, the works to be able to do it. You won't be able to see this very well here. I'll kind of read it to you. This is an ovarian cancer study, metastatic ovarian cancer trial. And these patients had a 50% reduction in complications when the drugs were given at the right time and in the right style of infusion. They had an 80% reduction in the need to reduce the dose. So what's relevant about that is that we know that when cancer patients have to reduce their doses, it's well documented, patients do far, far worse. And so this is demonstrating that Chrono allowed the patients to maintain optimal dosing. But what was really impressive is this number here. These patients, their 5-year survivals, 4 times as many patients were alive that received the chronotherapy versus the group that did not.